Just to give you a heads up, I am going to be recording this for some people who couldn't make it live, and we'll post it on our new YouTube page where we have a bunch of different trainings for you guys up there. All of our recordings, we're starting to put them up there to kind of have a bank so you can refer back to these things if you need to at a later time. So I see that we have some new people in attendance, so I want to welcome you all. We're happy to have everybody who could join us here today. I'll introduce myself for those of you who don't know me and give a little bit of an overview about what we do here as part of the Population Health Improvement Program at the Healthy Capital District Initiative. So my name is Shelby Leonard, and I am a public health planner here at HCDI, where I support the Capital Region with public health initiatives. I also run what we call our Community Health Liaison Task Force, which is designed for care coordinators, community health workers, anyone who is connecting people to community resources that ultimately support their health. We provide trainings like the one that we have planned for you today, like we did one on Medicaid last month, and we're trying to keep these trainings up on a regular basis, but we want to make sure that they're extremely relevant to you guys, because that's ultimately, what it's for. We also provide resources such as our Social Servants of Health Guide. Also, we're a collaborative where we can really help expand resource sharing. So if somebody has an event going on, I can pretty quickly get it out to a lot of the different CBOs around here, as well as directly into the community members' hands through those direct service professionals such as yourselves. And the last thing, we've always had a networking component as part of this task force as well. We wanted to try to have some networking opportunities to help foster these community connections and help break down those silos. Obviously now with everything going on, it's a bit harder to network. So, we've been struggling a bit with networking. It's a lot harder to incorporate the mingle into our, if you're familiar with the old term, we used to call these our munch and mingles. And so it's a bit harder to incorporate that mingle into an online training. So if anyone ever has any ideas, I'm all open. And if there's any other ways that you guys think would be helpful to connect with each other, really the purpose for this too is if you have a client that you're really struggling with, you can't find resources for something, chances are somebody else in a similar position from another organization might also be struggling with the same thing, or they might have from a previous client and now they already know that. So, just to help kind of try to save you guys some time by building those connections. So if anyone has any ideas on that, please do let me know. We here at HCDI have historically been and will continue to be a driving force in the region for the advancement of the care coordination workforce, including community health workers. We have a lot of initiatives going on right now behind the scenes to try to help advance this workforce. So I want to thank you all for taking the time to join us today as we go through what is long-term care coverage, how to obtain long-term care coverage, and how ICANN can help with long-term plan issues. We have two panelists today, both from HCDI. We have our ICANN coordinator, Krista Harbox, and our ICANN outreach specialist, Kathleen Clark, here with us today. We did set aside a good chunk of time for questions and answers, so please use this time to go through any general questions you have, or if you have any questions about specific clients, we will take those. You can put them in the chat box at any time, and we'll go through them at the end. Of course, just please remember to anonymize whoever you're referring to as well. I mentioned that I'd like to incorporate more of the networking or mingling back into our events, so I want to try to make it a little more personal. If you're willing and able to turn your camera on, we'd love to see your face, but obviously no pressure if you're not in that space. And lastly, we want to make this as interactive as possible, so please feel free to liberally use the chat box with any comments, any questions. And before we get started, I would love if everyone would take a moment just to introduce yourself in the chat, your name, your organization, and your role, just so we can see who's joining us today and try to help that networking a little bit. And while you guys are doing that, I will pass it over to Kathleen.
Hi, everyone. Can you hear me okay?
Yes.
Perfect. So I am the outreach specialist for our ICANN program, and I'm going to go through these slides, more of a conversation. As Shelby said, if you have questions, put them in the chat. Krista is going to help us along to fill in any other information and answer any questions that may come up. Towards the end of the presentation, she's going to be talking about how the plans work and the appeals process more specifically, and some of the things that have been happening with long-term care. Those of you that may have joined us last month, we did talk about how to get Medicaid when you have Medicare. So you'll have a little refresher on that as well during this presentation. But like I said, just have the questions come and stop us if you have them or if you don't understand something. So, yep, we are going to talk about the introduction to long-term care services through Medicaid managed care. And then a couple slides is the, couple more slides, Shelby, if you would.
Oh, sorry.
It's okay. I don't know if I can. So our agenda is going to be who we are, what ICANN is, what Medicaid long-term care services are, how do you join, how do you use a managed long-term care plan, and then how we from ICANN can assist getting you through that process or help with any issues that might come up while enrolling or while the clients are receiving those services. If you want to go to the next slide or two. So ICANN stands for Independent Consumer Advocacy Network. Throughout New York State, and really it's an ombudsman program that helps people who need long-term care services or more intensive behavioral health services, and that would be through PARP. And we go as far as to help newly enrolled people who are enrolled in Medicaid managed care. We can talk to them about their managed care plans as well as the long-term care plans as well. So what we're going to do is take you through the whole process of obtaining Medicaid, how to get into a long-term care plan, how to use your plan, and then if you have concerns or need to do an appeal, the services the clients aren't getting the services that they need, how we can get you through that appeal process. The next slide does, again, talk a little bit more about that. We help people who are enrolled in a Medicaid managed care plan who need long-term care services. And that can be at home, at adult daycare, nursing home. And again, those people that are living with mental illness or substance abuse who need more intense services or more customized services. We speak to anybody about this. We can help your clients, you, their family members, people who are making the healthcare decisions for your clients. Thanks, Shelby. Next one. So there are different kinds of plans that ICANN does work with. Most everyone is familiar with the managed long-term care plan. That's what everybody sees, or that's the basic what you have to have to get long-term care services. There's the PACE program, which is an all-inclusive, I'm talking with my hands and nobody's here, where all of your services are combined together. So that would be your long-term care, but your medical services as well. They're all within one group. And I believe, Krista, am I right? Eddie is one of those PACE programs?
They're the only one in this area, around this area.
Yep. And then there's MAP, which is the Medicaid Advantage Plus, which most of we see. Those are the combined plans when people have Medicare and Medicaid with the long-term care. People who don't have Medicare, and we'll talk a little bit about this as well, they're enrolled in Medicaid and they're managed long-term or their Medicaid managed care plan, and they need some home services. Long-term care services are offered and available through the regular MMC plans. It's just a matter of working with the plan to get those services. And then again, the health and recovery plans for the mental health and substance abuse. As you can see, we are throughout New York State. In all honesty, I'm not sure if these are all still the ICANN providers throughout New York State, but if you do have clients in any of the counties, we would be the resource to get you to the right place. And then again, like I said, some of the things that we do with COVID, of course, this has changed, but most everything now is going, we did meet with people in person, but of course things are done over the phone now. None of the services cost anything and they are confidential. We have a network of ICANN advocates that we all rely on and bounce questions off of each other and different situations. We have monthly meetings where we get updates on policies or trends. We do case narratives. So we're hopefully up to date on everything that's been going on with long-term care. And some of you might have already heard some of the changes. We do things like this for educational purposes. We'll do presentations for your agencies. We do like to get in front of consumers as well, and we were doing in-person meetings, and of course that's hard now. I know some agencies are still doing virtual meetings with consumers, and if anybody out there feels that this would be good for any of their people that they work with, we would be happy to do a consumer presentation for you as well. Okay, next slide. So actually two more. Long-term care. So really basically what it is, people with regular health insurance, including Medicare, Medicaid, their insurance pays for doctors, hospitals, medications, therapies, things, rehab, things like that. Rehabilitation services, I should say. Most plans don't cover the long-term care services that would be in the home or any of those other services that would go along with that. If you go to the next slide, these are some of the services that are covered under home care, and Medicaid will pay for personal care aides as well as home health aides, and do those basic ADLs for them. Yeah, that was okay. So the next slide talks a little bit about how you go, starts to get in how you get long-term care. So unless you have a plan, a private plan that covers long-term care services, and there are some New York State plans that do, from way back when.
I have 3 fucking days to get.
Is that somebody asking a question?
Hi, can you guys please mute your line?
But Medicaid is what covers long-term care. So most people who are on that need long-term care services in the home are going to have go through Medicaid. And it is now in most counties, if not all, that once you are eligible for long-term care services, it's mandatory that you enroll in a managed long-term care plan. Okay, and some of these slides are repetitive, but I'm gonna flip through them. We talked about the different types of plans that cover long-term care, and the different services, and there's a more extensive list coming up. But basically the plans have to follow the same rules as straight Medicaid. What Medicaid would cover, then the plans would have to cover. But the plans might cover different types of services or additional services, I should say, but they have to cover basically the same services that any Medicaid plan would pay. When a client is enrolled in a managed long-term care plan, they will get a care manager. And aside from just having a visit twice a year, they are the person that should be coordinating the client's care once they are enrolled. So doctor's visits, transportation, issues with the plan, making sure the aides are coming in, all that should be done through the care manager. And then if you wanted to go to the next slide. So here are some of the questions that you should be asking your clients if they appear to need long-term care. First is, do they have Medicaid, or do they have a plan that covers long-term care? 9 times out of 10, the answer is going to be no. So their first step would be to get enrolled in a community-based community Medicaid with long-term care. And there are facilitated enrollers, again, throughout New York State that help with that. Here in the capital region, our office has facilitated enrollers, and the Independent Living Center of the Hudson Valley, they do Rensselaer, and there are other agencies in the area in our surrounding counties that do that as well. So we would walk you through that process, help you through the application process, and then is when we start to bring in ICANN. So if you go to the next step, if you have, the second question, do you have Medicare? If the answer is no, then that's when they should be looking at their regular Medicaid managed care plan to see what, they're calling it mainstream, but what long-term care services or home services does that regular CDPHP or Fidelis or United Healthcare cover? If they have, so yes, these plans will cover your doctors, hospitals, medications, and any of your long-term care services. They call it LTSS. And I don't know, there might be some plans on the line that would be able to talk about that. And then the next one, if they do have Medicare, that would then make you, can you go to the next slide? So if you do have Medicare and you were then enrolled in Medicaid, that's what you call a dual eligible. And this is where the MLTC, the PACE, or the MAP plans come into play for the long-term care services. I'm sure a lot of you have heard about dual eligibles and those special needs plans. So what we would talk to our clients about who do need long-term care services are what plan would be the best for them. So if they have Medicare and Medicaid, we would talk about what is their best option. As Krista said, PACE, there's only one plan in this area, and that's through the EDI. Many people have taken advantage of it, but it is an all-inclusive type plan where all your services are done through a network of providers. And then there's the dual eligible, the MAP plans, where you have Medicare and Medicaid. And if you don't want your plans combined, then you would go with the Medicaid managed long-term care. But those are still kind of combined as well. What am I missing, Krista?
No, you're right. So the PACE plans are all inclusive. So they include your doctors, your hospitalization, all your care, your long-term care services. It all has to be from a provider that participates with that PACE plan. The MAP plans do include some of the medical as well as the long-term care. And then the Medicaid MLTC plans are just for long-term care services. So those plans are going to be like in addition to your Medicare and Medicaid, or or if you have like another like SNP plan or something, which is like another dual Medicare Advantage plan. It would be in addition to that would cover long-term care services and may cover additional services, which you would want to ask the plan upon enrollment.
Yep, thank you so much. I appreciate that. So the next slide actually explains it. The MLTC plan is separate health insurance that adds on to your existing Medicare and Medicaid specifically for your long-term care. You would be able to keep your original Medicare and your Medicare Advantage plan to see your doctors, hospitals, and all those other medical providers. And then the MLTC plan would just be for the long-term care services. You would then be able to continue to see whatever doctors you were seeing before. There are 3, 4 MAP plans that are the combined together, and I think Fidelis is one of them. Nicentia is one of them.
Fidelis, Essentia, VNS, NY Choice.
Yes.
Then there's the Eddie Pace program. I think there's one, I think Prime Health Choice is one too, but you really have to pay attention to the counties that all these serve. So depending on what county you're in, there is a link that has, like, you can click on the county and it will pop up the plans. I can send that in the chat. So if you do have a client that is looking for long-term care services, and is going through this process now and wants to look at the plans in the area, they can actually just click on the county in New York State and it will pull up those plans that are available.
Okay. All right, so if we go to the next slide, these are what the long-term care services that are covered. And mainly, again, it's the home care. When the day programs were open, it included the adult day program, physical, occupational, transportation. I don't know if anybody does MAS, but you will see if you try to order a ride for a client and they're enrolled in long-term care, it's the long-term care plan that coordinates those rides. Clients could be eligible for the home delivered meals, durable medical equipment, and again, all these other subsequent services as well. And this is not a complete list of the services.
Kathleen, I'm just going to stop you for a second because there's a question in the chat.
I saw that.
Lauren asked, how do you help someone who may need long-term care services but only has Medicare and their income is too high for Medicaid? Did you want to answer that or did you want me to answer that?
I can answer it. Well, I can answer it from the Medicaid perspective. I don't know if you were going to answer it from a different perspective.
You answer first and then I'll add to it.
So depending on what their income is, if they don't have another type of plan that would cover the long-term care, Medicare is not going to cover that. So really their option would be Medicaid, but there are options within Medicaid that might benefit them. So depending on their income, we would screen them for possibly a spend down, and then see what their spend down, if the long-term care services, could those bills cover the spend down for that month, so they could get those services. So they would still be paying out of pocket, but they would still be getting those services. Depending on why they need the long-term care services, there's the pooled trusts. So for people who are over 65, it's a little bit harder because you have to prove a disability. But if you have somebody who's under 65 and disabled, and their income is above the Medicaid income guideline, you can always look into the pooled trust to offset that spend down. But really it would come down to applying for Medicaid with the spend down to get those long-term care services.
And just adding to that too, depending on what kind of Medicare, like Medicare doesn't really cover home care services. There are some guidelines for it, but it's very, very tricky and very complicated in order to get. Most of the time it doesn't happen. But if people have like Medicare Advantage plans or stuff, you can always look into the summary of benefits. Some Medicare Advantage plans have very limited coverage. So if somebody needs like all of these ADLs that we're talking about, like cleaning, or not, besides like cleaning and personal care services, if they need like transferring, toileting, showering, things like that, may not be realistic under a Medicare Advantage plan. You may need, and most services you need to look into a long-term care plan option. But if somebody just needs somebody to come in and do like cleaning once a week because they have really bad arthritis or whatever the case may be, looking into what your plan covers can always be the first step before you do any of this. There may be some limited coverage underneath some Medicare plans. Not a lot, and I'm not saying that it's definitely going to be covered, but it's definitely a first step in looking into if somebody just needs like very simple basic care, not a lot at all. But for people who need a lot of services or more than one of those activities of daily living covered, a managed long-term care plan unfortunately is the only real option besides paying out of pocket or setting up that trust, like Kathleen said.
I'm going to keep going, but keep your questions coming. So the next slide talks a little bit more about how those combined plans work. And that would be when you have your Medicare and your Medicaid together, where it's a dual plan or a SNP plan, whatever term you want to use. But you would get a plan card, a Fidelis card, or a Nicentia card, or whatever. So you wouldn't be using your red, white, and blue Medicare card or your Medicaid card. Those would be combined into the one MAP card or SNP card. And again, for your clients, but you would want to make sure that the clients' providers take whatever plan that they decide to go with. Usually we see if people are with Fidelis previously, they stay with Fidelis with a SNP plan for their long-term care, or but those are their options. All right, next slide. These are just some guidelines for the different types of plans. The PACE plan, again, is the all-inclusive care plan. You have to be at least 65 years of age. You must go to the center where it's located. And again, it coordinates all your care, including your meals and any of those other services. And again, right here, the only one is at the Eddy. The next slide talks more about the Medicaid Advantage Plus, which is the dual plans when you have both Medicare and Medicaid combined. And again, this can be for people who over 18 are now disabled, and people who are over 65 as well. Here you would just make sure that if you decided to go into one of these combined plans, that their doctors take that plan. And unlike PACE, it's not where you have to go to one facility. So how do you join a managed long-term care plan? So the first thing is for people who have Medicare, you want to make sure that, let me just read that you have Medicaid but not Medicare. So again, it says if you have Medicaid but not Medicare, you would do it through your managed care plan. That's for people without Medicare. For people with Medicare, you want to apply for Medicaid first. Sorry, Shelby, next slide. So you want to apply for Medicaid first. With the facilitated enrollers, they would talk about whether or not they would have a spend down. And that process, with COVID, it's changed, but we say 30 to 45 days. Once the application is completed, DSS has 30 to 45 days. Within that time frame, once the application is completed, you want to start the process of getting the client evaluated for long-term care services. So there's a conflict-free evaluation through Maximus. They would come out and do an evaluation. And actually, these are the steps, and I'm going to go through the steps. You choose what type of plan, you look at the types of plans, and then you choose what type of plan, and then you would enroll. So if you go to the next slide, it gives more information about how to apply. So again, they can do it on their own, but it is paper applications. It's not through the marketplace. So you would use a facilitated enroller to help apply for that. The income guidelines are listed here for singles and couples. There are resource guidelines or resource limits as well as income limits. There's different rules, different caveats with Medicaid. So if you have a couple and their income is very high, there are ways of getting managed long-term care services and not having such a huge spend down for couples who have income over that $1,284. And that's another conversation that we could have separately, but that's part of that Medicaid application. This does talk about the spend down. If you go to the next slide, I'm sorry, Shelby. That's excess income. So it talks about, gives a little example of Sandra's income, the income limit for Medicaid, and what her spend down would be. That's the amount Sandra would have to pay each month in order to have Medicaid. The next slide talks about the different options for excess income. And one of the things I talked about was spousal impoverishment budgeting, which is similar to when when a spouse is in a nursing home and there's a spouse that's still in the community. It's called spousal budgeting. And that can also be done under the managed long-term care when one spouse is receiving services in the home and one spouse is still in the community. DSS will consider spousal budgeting, but you have to be enrolled in a managed long-term care plan. There's some special budgeting for people who are returning from a nursing home, where they can deduct their rent. And again, DSS would do all of this. So if somebody's in a nursing home, but they're planning on coming home, there's special budgeting that DSS does for that as well. I also talked about the special needs trust or the pooled trust. And again, that usually is for people who are people who are disabled. So if a client is over 65, they would have to prove their disability in order to use the special needs trust or the supplemental needs trust to offset their spend down. Informal bargaining with the plan, maybe, I don't know. I don't know if you would do that. So then let's talk, the next slide is about the conflict-free evaluation. So like I said, once that Medicaid application has been submitted, you want to start with the conflict-free evaluation. A nurse will come in and assess the client and assess the home. They're not affiliated with any plans. That's why it's called conflict-free evaluation. They will let you know right then and there if you're eligible for long-term care, and then you would move on to the next step. It is only good for 75 days, so you try to time it again with the Medicaid application. You don't want to do it too soon or too late, but you want to time it with the Medicaid application. Then you want to look at the different types of plans. I'm on the next slide, that are offered, and we talked about PACE, MAP, and MLTC. Once you decide, I'm sorry, can you just slide the next slide, Shelby? You could, again, this is where ICANN comes in. We can talk to you about the plans, talk to you about the services that you need, what plan might fit best, what type of plan might fit best. And then you could call New York Choice as well to decide which plan would be right for you. And then the next slide is the fourth step. Actually, there is a link there of the different plans that are available in each county. And again, these are things that ICANN can help with, especially if somebody has certain medications that they want to make sure are in the formulary, things like that. So then when you call the plan, they will come out and you will schedule an assessment with them. And this is when the plan comes out and decides how many hours your client will be eligible for home care. The next slide. So they will set up that assessment. They decide then how many hours of home care you get. We always suggest that there are other people there for the evaluation, just so all the information is put out there. We found that sometimes consumers want to be strong and say they don't need as much, or they're having a good day. and having a family member or friend there is helpful to say, yeah, but what about on Mondays or in the afternoon? And they don't have to go with the first plan that they want. They can ask for an assessment from other plans as well. Just remember that first conflict-free evaluation is good for 75 days. And then the next step is to actually enroll in that plan. You can call Medicaid Choice, you can call the plan yourself or themselves. However, however it's easiest for the client to enroll. And if you go to the next plan, it talks about enrollment, when services start. So if they are enrolled by the 20th of the month, their services could begin the 1st of the next month. Usually it's the 15th, but with these plans, it's the 20th. And it does say the entire process can take 1 to 3 months. And I think Krista can attest to that too. Sometimes if there's not a lot going on and there's not a lot to be evaluated, it can go quicker. If DSS is doing their turnover within 30 days, but we generally 45 plus days is what we're seeing. Are there any other questions up to now or no?
Not in the chat, but if you do have questions, feel free to write them in. I'm watching to make sure that we answer all your questions.
Krista, were you going to take the next part or was I? Yeah. You want to talk about how to use your plan?
Yeah, so Shelby, you can go to the next slide. So once all that enrollment is done, then you're going into like the meat and potatoes of like having the plan and dealing with all of your concerns, your problems, making sure you're getting your home care. So one thing that I want to touch on going back, you don't have to move back, Shelby, but like just going back, most of the time when we're dealing with managed long-term care for the ICANN program, we're dealing with somebody who has Medicare, Medicaid, and looking to get onto a managed long-term care plan. But as Kathleen said earlier, you can also, people who don't have Medicare can also get managed or long-term care services through their Medicaid managed care plan through the marketplace. In order to do that, you do have to contact the plan, and your provider has to send over paperwork to that plan in order to get your long-term care services set up. And plans are usually structured. You have your managed care plan, and they handle your home care, your transportation, and your dental services. You can move to the next slide. Okay, so working with your care manager is key. I can't say that enough. I do a lot of our ICANN caseload. I have done so many appeals and complaints and things like that for clients, and the first thing that I always do when there's a problem or there's an issue arise is I contact that client's case manager. So, you know, when I'm collecting information and working with a client, that's one of the pieces that I collect because it's good to have that collaboration to let them know that something's going on. They visit twice a year, so after you get accepted for the plan, you get 2 visits from them, once every 6 months, and then that's when they reevaluate your care, making sure that everything is working for you, seeing if you need more hours or maybe taking them away, which happens more than increasing hours, and kind of developing and adjusting that care plan as necessary. You can move to the next slide. And there's different ways to communicate with your plan if that care is not what you need. So if you need more care, if you are not happy with your care, if you got a decrease in services and now you need to appeal that decision. And this is what a lot of people reach out to ICANN for because they get that notice. And if you go to the next slide, I think there's a copy of the notice listed on there, but it may be the next one. You can just skip to the next one. I'll go back to this. Oh wait, one more. Sorry guys. So this initial adverse determination notice is what a lot of people get when stuff is changing with their plan and they just don't know what to do. They get it, and they're like, my plan's reducing me. I don't know what to do. Like, I had 50 hours a week, and now they're saying they're only going to give me 20. I need those hours. And a lot of times there's paperwork in there that they fill out in order to get, you know, more hour or to appeal the decision. But having the resources and the policies that go behind it to help uphold that decision and keep them at the hours that they're at is really important, and that's where ICANN can really come in and help somebody out. If we go back a couple slides, you don't have to go back, Shelby, but I'll talk about it. There was like new service authorizations too, so that's when we're trying to request new services for clients. So I'm going to use an example of a client that I helped recently who had surgery on her foot. She was getting about 20 hours a week, and she needed an increase up to about 50 hours a week in order to help her get around and help her do things that she wouldn't have been able to do before because now she's got an injured foot and she's unable to do a lot of the cleaning services and stuff that she normally was able to do before. So to be able to write, ICANN came in and helped her write up a new service authorization saying that this client needed more care. These are the hours that she's looking for. These are the reasons why. We got a doctor's note and worked with the provider in order to include while it was medically necessary, submitted to the plan, and then we got that approved. So that way she was able to get more care. So, you know, that's one of the things ICANN deals with, and then these denials or decreases or problems with the plan to help with those appeal processes. So, you know, the appeal process goes, they'll get a letter like this, and usually these happen after those 6 months evaluations. And if you look at the letter, it will state all the client's information at the top. It will say why they're getting the notice. It will state what they had before, what they're going to have now, why, and then it will state all the reasons why they're saying. And there are some reasons out there that plans just put, and it's not a valid reason, and it's very easy to appeal, but you have to have the right tools and the right policies to show, like, that's not a valid reason. This client still needs these services. So having ICANN or somebody to help you with that is extremely helpful. I'm happy that so far we've been doing the ICANN program for about a year now, and out of all the clients that I've helped, I haven't had one person get their care reduced, whether it's doing an appeal or going to a fair hearing. So that's pretty great. And these initial adverse determination notices will be mailed out within 10 days of getting like an evaluation or something done, and they will let you know when they'll give you at least 10 days before the actual transition becomes effective. You can go to the next slide. You can go to the next slide, Shelby. It's not moving. Hold on one second, guys. Sorry, some technical difficulties. I think there's a question, so, oh no, that's Kathleen. This is basically what I talked about doing an appeal. I always contact the case manager when doing an appeal because it's really helpful to talk to them first. And then I do a letter off with policies included and the form that comes with the actual initial adverse determination. I include all of that together. There's, if the initial appeal doesn't work, there are other options, because sometimes you'll get that back and they'll say, no, we're still denying the services, we're still decreasing your hours from, you know, a lot of cases I deal with are split shift cases, which are 24-hour care, and then they get reduced to like 50 hours a week. So, you know, working with that, you know, sometimes the plan will come back and say, no, we're still reducing your hours. And then you have other appeal options. You can either do what's called an external appeal, or you can do what's called a fair hearing. External appeals are mostly for other services besides reductions. So managed long-term care plans can also cover some dental, some durable medical equipment, things like that. So if you have problems with those services, then an external appeal may be a good option. You can go to the next slide, Shelby. If not, a fair hearing is a better option. ICANN, about a year ago, stopped doing fair hearing assistance, so we can no longer go to a fair hearing with the client. But what we can do is we can help the client, and we can write up a almost like a summary of like what they want to talk about at the fair hearing. So we'll talk about, you know, like we'll put some policies in there that people can refer to. We'll make a nice little chart of like, this is why it's being denied. This is the policy that reflects it. So so the client has the tools to bring with them to the fair hearing where they feel comfortable going and presenting the information. And then I'm sorry, these slides are not quite in order, so I apologize. The previous slide from this is about complaints. So complaints are, was it in the next slide? Maybe it was, I'm sorry. But complaints are something that you can do if you're unhappy with the plan. So if for some reason you're not getting aid services and you were approved for 30 hours a week and they are only giving you 10 hours a week and they're just saying that they can't fill those slots, you can submit a complaint to the Department of Health. If your care manager just doesn't call you back, you can submit a complaint because they're not getting back to you and they're the person responsible for helping you with your care. If you have problems with aides that are rude to you, aides that are stealing from you, aides that are just not doing the work that they're supposed to be doing that's laid out in that care plan, you can file a complaint with the Department of Health. And ICANN can help with this as well. We have, we were able to write up stuff and submit it for you. Next slide, please. So this just lists basically your rights for being with or having a long-term care plan. It's a lot of stuff that we went over already. Receiving medically necessary care, having timely access to the care, privacy about your medical treatments, getting information about those treatments and being able to understand them, getting the information in the language that you speak, and so on and so forth. It's just the basic rights that we all have in the healthcare field, but just listing them there so that way your client knows and feels comfortable with them. Next slide. And here's just a couple more. And, we keep saying, and ICANN can help, and ICANN can help, and it's because we are here to help. So, long-term care is by no means an easy process. It's a very confusing process, and sometimes we're learning as we go as well. So it's really important to, seek resources for your clients if necessary in order to help them. Because, being able to, find the necessary, policies that help reflect and support the reasons why you're upset or your client's upset or angry or needs specific services from their plan and is not getting. Sometimes it's easier, and a lot of my clients I deal with, they are so thankful to have somebody that can assist them with this, because a lot of times they're going through so many other things that this is very hard for them to do on top of trying to take care of themselves and trying to manage all of their treatments and services. Next slide, please. So this just went over how we can get help from ICANN. It's this whole presentation. This is my contact information. I do a lot, like I said, I do a lot of the caseload. So not only like the appeals, new service authorizations, the complaints that I went over, but also everything Kathleen went over, anywhere from somebody calling just to get information about how to get long-term care services, all the way from helping them call Maximus to schedule that initial evaluation, and getting all of that set up. I do all of that. So feel free to send your clients over to us if they need help. This is what we're here for. So hopefully this answered a lot of your questions. And if you do have any other questions, feel free to put them in the chat, but also you can email me at this email right here or call me, or reach out to Kathleen as well. She's more than happy to answer any questions too. So I think we're all good now. So if, I don't know if you want to open up like the lines for people to ask questions, in addition to the chat or whatever works, Shelby.
Yeah, so if anybody has any questions, definitely feel free to put them in the chat right now, or you can unmute yourself. If while I'm giving you guys some time to think of questions, I want to kind of pivot our conversation just a little bit. With everything going on, I'm sure you all are aware that we're in the midst of a mental health crisis, in addition to everything that's going on with COVID. I mentioned this in our latest newsflash, but I work pretty heavily with all of the county health departments, and they're reporting that they're seeing a lot of increases in substance use overdoses as well as suicides. This isn't exactly surprising, but it begs us to wonder what more we could do. So I did share some resources in that latest news flash, just some things that are going on in the region for you to share with your clients, if that is helpful. But what we didn't talk about was the importance of self-care and wellness. And I know that many of you guys are thinking about your clients and their needs, and you're having increased caseloads, and this can all be extremely stressful. And it's so important that you take some time to focus on yourself, especially when you're working with these clients who are in extreme stress. Compassion fatigue is real. And on top of everything else going on in the world right now, I'm sure it's so easy to feel overwhelmed and stressed. I know I personally am not great at self-care. I'm trying to incorporate this a bit more in my own life. One of the things that I've been doing is reducing my cell phone usage and social media usage. I just take my phone and I lock it away and I do something else. I'm like, I have to completely take a break from that kind of activity. And so here at HCDI, we've decided to pursue this a bit further. We're looking at developing a new self-care initiative, really to help support you all as our kind of beginning audience here. And because you can't give all your empathy to your clients if you're not taking care of yourself. And so with all of that being said, we do have a couple of ideas, but if we are looking for some help with ways to promote self-care and mental wellness in the community, and just curious if anybody would like to help us with this going forward as well. And if you have any ideas that work for you to engage in self-care, please feel free to share them in the chat box. I think that sharing these sort of ideas is helpful for other people. But with that being said, I'm going to pass it over now to my coworker, Veronica. She is a social worker, and she just joined us here as one of our new public health planners. She's going to take us through a little exercise on something that we can do right here at our desks just to help us relax for a minute. So, Veronica.
Hi, everyone. Can you hear me okay?
Yes.
Okay, awesome. So hi, thank you, Shelby. Like Shelby said, I just joined HCDI about 3.5 weeks ago. I am a mental health social worker by background, and now I'm working in public health. With just my background gives a very different focus, I guess. And I'm going to share a link in the chat. And this is, this is a breathing exercise. Some of you might already be familiar with it. It's called square breathing. It's also known as box breathing. And some people appreciate the visual, and you might want to print it out or just save it in your favorites on your computer, so you can reference it that way. For other people, you don't need the visual. You can just remember the process of it. But this is an exercise we can do literally anywhere and everywhere, like whether you're at your desk, whether you're driving in your car, whether you're with a client, whether you are in the grocery store in the checkout line. It's something you can do anywhere and everywhere. You can do it whether you're stressed out or anxious. You can do it if you're not feeling that way yet, because deep breathing can also help prevent anxiety from coming along. So I guess what I'll do now is count with you. Forgive me, this is probably a really cheesy thing to be doing in a webinar format. I've done it one-on-one with clients when I've worked as a psychotherapist in the past, but now I just realize how odd it is for me to be staring at some faces and everything. But essentially, the point of the exercise is that you breathe in for a count of 4, hold your breath for a count of 4, exhale for a count of 4, and then hold again for a count of 4 before you start breathing in again. When I see a comment, somebody does the 7-7-7 breathing. Awesome. And like I actually most often do 8-8-8, which is a similar concept. Like you breathe in for a count of 8, hold for a count of 8 or 7 in this case, and then have a slow exhale for a count of 7 or 8. So work with me here, everyone. And so take a second, well, a few seconds, breathe in, 1, 2, 3, 4, hold, 2, 3, 4, breathe out, 2, 3, 4, hold, 2, 3, 4, breathe in, 2, 3, 4, hold, 2, 3, 4. Yeah, 2, 3, 4. And then hold, 2, 3, 4. So just 2 cycles of it can make a difference. You can try to do it for a whole minute or really until you're feeling better. But I am also mindful of the time and realize that some people probably need to get back to work. I'm also going to type in my email address here in the chat box in case anybody has any questions, or if you are not in front of your computer for this, if you'd like me to email this to you, anything like that, feel free to reach out to me directly as well. So anyway, thank you all for your time. And I mean, any quick questions now?
I did see a question in the chat. I hope you don't mind. I'm going to jump in here. I was trying to type it and answer it, but it might just be easier to answer it verbally. So Tammy asked, with the Eddie Daybreaks closing and in-home health aid shortages, with a pandemic now on top of it, are there any initiatives to help with in-home care services? So this is a great question, so thank you for asking this. This is a lot of stuff that I've been dealing with right now. So with day programs closing, the MLTC plans are required to fill the hours that a client would normally get, but are no longer getting because they're not in that any day program services. So they are required to fill that with home health aides. That being said, as you said, a lot of their excuses are, there's a home health aide shortage, we don't have the aides to fill the hours. If the plans can't find aides to fill the hours, they are required to go out of network to find aides to fill those hours. Clients are approved for those services. It's within their care plan, so it is their responsibility to find aides to fill those slots. So my suggestion would be to call the plan and let them know that, the client should let them know that they're not receiving hours and they need to find the hours. And if they're still having problems with it, you can always give them my contact information. I'm more than happy to get a release signed and contact the plan for them to try to get them the hours that they need. Hopefully that answered your question. If you have any other questions or follow-ups, let me know.
Yeah, and so if you have any questions either for Krista or Veronica, or any self-care ideas, or if you want to be a part of that initiative to help promoting self-care, please you can put any of that in the chat box at any point. You also can feel free to reach out to me to get to any of these people as well. I know it's kind of like we're shooting a lot of HCDI names at you, but you guys can feel free to reach out to me and I'll hook you up with whatever you're trying to get to as well. One of the other things I did want to take just a few minutes here to kind of discuss, I wanted to open it up for a brief conversation. I know that you all are inundated with meetings right now and you're always staring in front of the computer, so I haven't been putting task force meetings on your calendars, mostly because I figured that that would be an added thing that nobody really wants to deal with right now. So with that being said, I did want to just mention that, I'm still here for support. The only reason why we've been cutting the meetings is simply for all of your guys' benefits, but I still am here for support. So I wanted to just throw it out there. If there are any issues that anybody wants to raise that you're having, or any issues that your clients are having, feel free again to do that in the chat box, or go ahead and unmute yourself. Anything that you're struggling with, anything you'd like a training on, or support from others in this space. Any type of resources you're struggling to find. And so just getting a sense of like what type of issues are your clients dealing with. If you know of any of those right now, you can let me know. If something comes up, feel free to send me an email. We'll try to do a training on it. If we can, we'll try to pull together whoever we can to help you find those resources. Somebody once asked me for a list of child care opportunities in Schenectady City County, anything like that, feel free to send that out to me. And again, ideas for future trainings as well. And then I do want to share one thing with you guys. I should have had up a little bit. Just give me 1 second here. Oops. So I think some of you may be familiar, but let's share my screen here. Okay, so just wanted to let you guys know that we have created some self-management guides for the general public as well as for providers. Really anybody can kind of use these, but so essentially this is a resource guide of support services and education for diabetes in the area. So it starts off with, with some general, like what is prediabetes, what is your risk, and here's your risk test for both prediabetes and diabetes. But then it goes into, what type of resources are around in the community for each of, the different components. So we get into physical activity, we get into health, we get into nutrition. We have the different diabetes prevention programs, things like that. This is a guide that really, I think will help people manage their diabetes. We've had it for a few years, but we just updated it and we've gotten a lot of good feedback from it. So if you do have any clients that are struggling with diabetes, we do have this available freely online. We also have printed copies. If you'd like, please send me an email and I can have them mailed out to you. We also have this guide in Spanish. So I know that is a huge need. So if you have any clients that are diabetic and they speak Spanish, we do have that available for them. So, okay. Okay, so if there is any other, I'm going to leave it open for a couple more minutes. Does anybody have any questions for Krista and Kathleen? Any ideas on future trainings or any issues they're having? Any of that? Oh, we do have a question. Any of the HCDI staff have an update on EISEP service?
Yeah, so I did answer it in the chat, but I'll answer it out loud as well. ISEP, EISEP stands for Expanded In-Home Services for the Elderly Program. I think I got that right. Unfortunately, ICANN doesn't really dive deep into the ISEP program. I know about it, I know what it does, but we don't really have info on how long the wait list is or what availability is. I do know, I think you normally contact New York Connect for that. You could always try calling New York Connect and seeing if they have an answer on that or if they can give you information on that. But unfortunately, I don't have that information. I'm sorry.
Is there any other questions? Well, if there's nothing else, you're next to be happy to assist. Okay, great. Oh, lastly, I do want to say that if you're not on our listserv and you would like to be, please send me out an email. And if you have any community events that you would like to share, you can also feel free to send me that in an email as well. In Our Own Voices did share with me today that they're going to be restarting their Cafe Con Leche series, which is a discussion. It's for a discussion on violence and its impact on LGBT communities of color. It's also to help assist them in developing community-based solutions to creating safer communities. So that's going to be tomorrow from 6 to 7:30 p.m. If you'd like the Zoom link, you can feel free to reach out to In Our Own Voices or to me, and we'll send it to you. So again, no more questions. Thank you all for joining us, and I look forward to virtually seeing you all shortly.
Thank you, everyone. Have a good day.